So hello everyone, our today's topic is about the submandibular region. So remember the submandibular region, it is like a backstage of your mouth that is hidden between the mandible and the hyoid bone. So imagine the muscles the muscles here, they are the workers and they help with the various mouth movements. Now think of submandibular gland and sublingual gland as factories that produces saliva. So saliva, it helps you to chew and swallow the food, making it easier for your stomach to digest. Now let us introduce another character member that is known as coda tympani. So it's like a manager that tells the saliva factories when to start working. So this manager also brings a special message about taste from your most of part of the tongue. So here is a twist. There is a special area on your tongue that are known as a circumvallate papilla. Now this circumvallate papilla, remember, they have their own messenger that is known as a glossopharyngeal nerve. So it's just like having a separate delivery person just for this special taste area. So in short, the submandibular region is the backstage with the muscles, saliva factories and ganglion. All these work together. The manager, that is the coda tympani, makes sure everything runs smoothly, including delivering the taste messages. And the special taste areas has their own delivery person, that is the glossopharyngeal nerve. So that's the simple story of what's happening in the submandibular gland. Now let us discuss the muscles that are involved. The first is the digastric muscle. So picture this muscle, it has two parts. One is the anterior belly, this one is the anterior belly, and this one is the posterior belly. So these both, they are connected by this middle tendon, right? So the front part, that is the anterior belly of digastric, it will start here from the digastric fossa. So remember that the anterior belly it starts from digastric fossa. This one is the digastric fossa. So this one is the digastric fossa of the mandible, while the back part, this part, the back part is the posterior belly of the digastric. It begins from the mastoid notch on the temporal bone. So this belly is the posterior belly of digastric. Remember that. Now both bellies, they meet at a common tendon. So this posterior belly and the anterior belly, they meet here at this common. This one is the tendon, the common tendon. So this tendon, it goes through the stylohyoid muscle. So remember, this one is the stylohyoid muscle. To attach to this one is the hyoid bone. Right. Now the nerve supply, the anterior belly, it is controlled by a nerve that is related to the mylohyoid nerve, right? And the posterior belly, it is controlled by facial nerve. So these are the important MCQ that you can get in your exam, that the anterior belly, the nerve supply, it is controlled by, the anterior belly is controlled by a nerve related to mylohyoid nerve, and the posterior belly, it is controlled by the facial nerve. Now what second question is the action of these muscles. So the anterior belly, it helps the jaw down when you open your mouth widely. So when you open your mouth widely, so it helps to pull the jaw down while you open your mouth against the resistance. Whereas this posterior belly of digastric, this would help you to elevate the hyoid bone. The other muscle is the stylohyoid muscle. Well, it is a small muscle that sits on the upper border of the digastric muscle. So this one is the stylohyoid muscle, right? It is a small muscle, and it originates from the posterior aspect of styloid process. All right, and it is inserted, the muscle, remember, it has an intermediate tendon that goes through, and it is held by this hyoid bone. So the junction of body, it is inserted into the junction of body and greater column of the hyoid bone, and nerve supply, it is controlled by the facial nerve. Now what is the action of a stylohyoid muscle? So it will pull the hyoid bone backward, upward and backward. Along with the other hyoid muscle, it helps in stabilizing the hyoid bone. So the stylohyoid muscle, it helps in pulling the hyoid bone up and back. And digastric muscle, they helps with the jaw movement, they help to raise the hyoid bone. So they all work together like a team in the thyroid area. The other muscle is the mylohyoid nerve. So remember the mylohyoid nerve. So this muscle, imagine it as a flat triangular shaped that is forming the floor of mouth. So there are two mylohyoid muscles deep to the digastric muscle. So the fibers, they run towards the middle and slightly downward. The posterior fibers, they connect to the body of hyoid bone, and the middle and anterior fiber attach to the median raphe between the jawbone and the hyoid bone. So this one is the insertion. Now what is the action of this mylohyoid nerve? Remember that it helps you to elevate the floor of mouth. So during the first stage of swallowing, it helps you to elevate the floor of mouth. It helps in lowering the jaw and raising the hyoid bone. The other is the geniohyoid muscle. Think of it as a short, narrow muscle that is positioned above the middle part of mylohyoid. The geniohyoid, it starts from the genial tubercle, and it is controlled by the hypoglossal nerve. The action of geniohyoid is it contributes to lowering the jaw when the hyoid bone is fixed. So other important muscle is the hyoglossus muscle. Remember that you can get a question, identify this. This question was asked in one of your NEET entrance exam, identify this muscle. The answer is hyoglossus. Now remember that what is the action of hyoglossus muscle. So it depresses the tongue. Now let us start with the origin first. So it starts from the greater cornu and lateral part of the body of the hyoid bone, right? And it is inserted into, it attached to the side of tongue between other tongue muscle. So between the side of tongue is its insertion, and its origin is from greater cornu of the hyoid bone and lateral part of body of the hyoid bone. Now it is controlled by which nerve? It's the hypoglossal nerve. Now what is the function of this muscle? It depresses the tongue, makes the top surface of tongue that is convex. So in a simpler words, the mylohyoid, it helps in swallowing and jaw movement. The geniohyoid support the raising hyoid bone, and the hyoglossus that helps in various tongue movement. So together they play a role in essential functions like the swallowing or the speech. Now let us discuss what are the deep relation of the hypoglossal nerve. So it can be hypoglossal, they can be either superficial side, so it can interact with the muscles like styloglossus, lingual nerve, submandibular ganglion, submandibular duct, hypoglossal nerve, and veins near the hypoglossal duct. The deep part are the genioglossus, middle constrictor of pharynx, glossopharyngeal nerve, stylohyoid ligament, lingual artery. So these are the important relation between the deep relation of the hypoglossus nerve. Now let us coming to the submandibular salivary gland. So this one is the submandibular salivary gland. Now remember that the gland, it is a size of a walnut. So it resembles just like a size of a walnut, and it is J-shaped, and it weighs around 15 to 20 gram, and it is located where? In the anterior part of the digastric triangle. So this gland, it is enclosed by two fascia. One is the superficial fascia and other is the deep fascia. So the superficial fascia, it covers the inferior surface attached to the base of mandible, while the deep layer, it covers the medial surface extending to the mylohyoid line of the mandible. So remember, it has three surfaces. What are the three surfaces? Inferior, lateral, and the medial. So three surfaces, remember, are the inferior, lateral, and medial. So these are the covering of the superficial part of the submandibular salivary gland. So we discussed that the superficial layer, it covers the inferior surface and attached to the base of mandible, while the deep layer, it covers the medial surface extending to the mylohyoid line of the mandible. Other is submandibular duct. The other name is Wharton's duct. So remember, it is a thin walled and it is 5 centimeter long, and it emerges from the deep part of the submandibular gland, running forward on the hyoglossus muscle between the lingual and hypoglossus nerve. It crosses the lingual nerve at the front border of hypoglossus of the hyoglossus, and it opens. Remember, where does it opens? It specifically opens on the floor of mouth at the summit of sublingual papilla at side of the frenulum of the tongue. Now the blood supply and the lymphatic drainage. The blood supply to the submandibular gland, it is supplied by the facial artery. Well, the facial artery, it originates from this facial artery, it will originate from this external carotid artery just above the tip of the greater cornu of the hyoid bone. So it run upwards on the superior constrictor of pharynx, reaching between the posterior belly of digastric and stylohyoid, reaching the ramus of mandible. So it forms a S bend winding over the submandibular gland and then over the base of the mandible. So remember, in the entrance exam you can get this question: the facial artery, it is palpable on the base of mandible at anteroinferior angle of the masseter muscle. That is important for your exam point of view. So facial artery, it is palpable on the base of mandible at the anteroinferior angle of the masseter muscle. Now coming to the nerve supply, well, it is supplied from the submandibular ganglion. So they will secrete. The first is the secretomotor fibers, second sensory fibers, and third are the vasomotor sympathetic fibers. From the plexus around the facial artery. So let's simplify the secretomotor pathway of the submandibular and sublingual glands. So they start from the superior salivatory nucleus. The origin of secretomotor fibers is from nervus intermedius. So intermediate nerve carrying the secretomotor fibers is the facial nerve. It then moves to the chorda tympani. The branches of facial nerve carries the secretomotor fibers. The chorda tympani, it joins the lingual nerve, and the location for relay is the submandibular ganglion. So the location for relay for nerve fibers is the postganglionic fibers. It passes from ganglion to reach the submandibular and sublingual glands. So in the simpler words, the secretomotor pathway, it starts in superior salivatory nucleus, and then the nerve signals travels through the facial nerve, chorda tympani, lingual nerve. The submandibular ganglion, it acts as a relay station, and from there the postganglionic fibers reaches the submandibular and sublingual glands regulating their secretions. Other is the sublingual salivary glands. So, which glands? Remember, they are the smallest of all three salivary glands. It's the sublingual. That means they are smallest of all three salivary glands. And what is their weight? Their weight is 3 to 4 gram. Where they are located? They are positioned over the mylohyoid muscle, beneath the mucus of the mouth floor, medial to the sublingual fossa, and lateral to the genioglossus muscle. So around 15 ducts emerges from the gland, with most opening directly into the floor of mouth. On the summit of the sublingual fold. Now the blood supply is from lingual and sublingual arteries. The nerve supply is similar to the submandibular gland. Next is the submandibular ganglion. So remember, it is a parasympathetic peripheral ganglion. So it acts as a relay station for secretomotor fibers to submandibular and sublingual gland. So both to the submandibular and this sublingual gland. So it is positioned on the hyoglossus muscle above the deep part of submandibular salivary glands, suspended from the lingual nerve by the two roots. So functionally it is connected to the coda tympani. That is the branch of the facial nerve. So in simpler terms, the sublingual salivary glands, they are the smallest among all the salivary glands situated beneath the mouth mucosa. It has multiple ducts opening into the floor of mouth. The submandibular ganglion, it acts as a relay station for nerves controlling the salivary gland function, and it is related to the lingual nerve and the facial nerve. Now let us discuss about the connection branching that are involved in secretomotor fibers, sympathetic fibers, and secretory fibers that are related to the submandibular ganglion. First is the secretomotor fibers that we have already discussed, that is, they originate from the superior salivary nucleus, passing through the nervous intermediates, facial nerve, coda tympani, and the lingual nerve. So then there is a ganglion connection that travels through the posterior root to reach the submandibular ganglion for the relay. So this one is the secretomotor root. So the post-ganglionic fibers, they reach the submandibular gland through 5 to 6 branches from the ganglion. The sympathetic, remember the sympathetic fibers to the sublingual gland, they are derived from the plexus around the facial artery. So the pathway is the postganglionic fibers from the superior cervical ganglion. It passes through the submandibular ganglion without relay. And the target is to supply the vasomotor fibers to submandibular and sublingual glands. The sensory fibers, they reach the submandibular gland through the lingual nerve. So in simple words, the submandibular ganglion, it is hub for various nerve fibers. The secretomotor fibers originating from superior salivator nucleus travel through the facial nerve to reach the ganglion for the relay. The postganglionic fibers then go to regulate the salivary glands. The sympathetic fiber source is from the facial artery plexus, directly passes through the submandibular ganglion to influence the vasomotor function in the gland, whereas the sensory fibers, they also find their way to ganglion through the lingual nerve. So it is like a central control station that controls the different aspect of saliva production and the gland function. Now let us compare the three types of the glands. One is the parotid gland, other is the submandibular, and third is the sublingual gland. So which one is the largest? Is the parotid gland, right? The parotid gland, it is derived from ectoderm. The submandibular, it is derived from endoderm, and the sublingual is derived from endoderm. The parotid gland, it has a duct that opens on the vestibule of mouth opposite second upper molar tooth, right? Whereas the submandibular gland, it has a duct that opens into papilla in the sublingual fold in the floor of mouth. Whereas the sublingual gland, it has 10 to 12 duct that opens in the sublingual fold in the floor of the mouth. Now the parotid, it is type of purely serous secreting. Whereas the submandibular, it is a mixed variant that contains both serous as well as the mucus. Whereas the sublingual, it's a purely mucus. The parotid gland, the secretomotor fibers, the secretomotor roots, it is from 9th cranial nerve, and for sublingual, it's from 7th cranial nerve, and for the sublingual, it's again the 7th cranial nerve. The sympathetic root for the parotid gland is plexus around the middle meningeal artery. For the submandibular gland, it's the plexus around the facial artery, and it follows same as for the submandibular as for the sublingual gland. So these are important points. Now let us simplify the clinical anatomy points. The coda tympani, we know it supplies the secretomotor fibers to submandibular gland, and the sublingual gland lies medial to the spine of sphenoid. The auriculotemporal nerve, it supplies the secretomotor fibers to the parotid gland. It is related to the lateral aspect of spine of sphenoid. Injury to spine may affect both the nerves, leading to loss of secretion from all three salivary glands. The submandibular lymph nodes, they are present both within and outside of the submandibular salivary glands. Removal of the gland, it may be necessary if the lymph nodes, they are affected, especially in the diseases like carcinoma of tongue, etc. The mylohyoid muscle, we know it divides the submandibular gland into superficial and a deep part. The enlarged lymph nodes around and within the gland can be palpated. Apart from that, you should know that the duct of the submandibular gland may be impacted by stones that are visible on radiograph. So manual palpation of submandibular gland and surrounding lymph nodes can be done by placing finger inside and outside the mouth. So excision of the submandibular gland for the calculi or tumor removal involve incision just below the jaw angle, considering the position of marginal mandibular branch of the facial nerve. That is important for your exam point of view.